And coming to the tetanus part 2, and we are covered in part 1 introduction and what is the causative organism for tetanus and what is the epidemiology of tetanus and what are the incubation period for tetanus and what is the pathophysiology of tetanus and what are the special types of tetanus. We are covered in the part 1, and in part 2 we are covered all clinical features and how it is diagnosed and how it is treated. Okay, then coming to the clinical features of tetanus, and what is incubation period means the time from injury to the first symptom occurs. The first symptom occurs within 7 days or occur within 3 to 21 days also. And what is the period of onset, which means the first symptom to the reflex spasms. So what are the symptoms we are included? They are triad of muscle rigidity and spasms and autonomic dysfunction. The early symptoms, which include neck stiffness and sore throat and poor mouth opening, there is dysphagia, and other complaints which include dysphagia, restlessness, reflex spasms, which is usually continuous for 3 to 4 weeks. They're increased. Subsequently, muscle rigidity and rigid abdomen also takes place. And the main important symptoms, which include rhesus sardonicus, which means the sustained contraction of the facial musculature, that is at the angle of the mouth and frontalis, which produces this sneering grin expression, that is called rhesus sardonicus. Another one is trismus, which is also called as lockjaw, which is mainly due to spasm of the masseter muscles. Okay, generalized tetanus may also include in the tetanus also, trismus also. Another one is opisthotonus, that means spasm of the extensor of the neck, back and legs to form a backward curvature. Okay, another one is muscle spasticity. Another one is dysphagia, pharyngeal muscle spasms takes place, and reflex spasms, which include mainly due to certain stimuli triggered by the noise, light and touch, which last for seconds to minutes, which is very more intense and increased in frequency with the disease progression also. Okay, and the muscle rigidity is descending pattern, which spreads through the descending pattern like from jaws and facial muscles over the next 24 to 48 years towards the limbs and stiff proximal limbs muscles, sparing both hand and feet, and which also leads to poor cough, inability to swallow, gastric stasis, okay, which increase the risk of aspiration, and respiration failure mainly causes the mortality, but autonomic dysfunction may increases the death rate, and laryngeal spasms occur at any time. Mainly asphyxia takes place, unable to breathe. Asphyxia means unable to breathe. Another one is autonomic dysfunction. Mainly the tetanospasms increases the disinhibitory effect on the autonomic nervous system due to increased release of the catecholamines, which leads to hypopyrexia, sweating, hypertension, tachycardia, dysarrhythmias, cardiac arrest. These all takes place. Other symptoms, which include drooling, fever, usually absent, hand and foot spasms, and irritability, uncontrolled urination, and defecation takes place. The usual duration of clinical tetanus is 4 to 6 weeks. And coming to the diagnosis, how it is diagnosed, the tetanus is diagnosed no blood test or no blood test are not taken, and diagnosis is only done based on the presence of trismus and dysphagia and muscular rigidity or spasm, and laboratory studies which shows peripheral leukocytosis and cerebrospinal fluid studies within the normal limits. And another one is SA for antitoxin levels are also not readily available, but 0.01 IU per ml or greater in serum, which is protective, and tetanus less. And another one is direct smear. It shows gram positive bacilli, that means drumstick appearance occur. In culture, which is done in blood agar under anaerobic condition by using Roberts Cook medium, and the growth occur 1 to 2 days incubation, and animal inoculation demonstrate the toxicity usually the test is done in rabbits. The death of the rabbit also takes place after 2 days. And what are the procedures which involved? One is the spatula test. By touching the oropharynx with spatula or tongue blade, if the patient elicits a gag reflex, there is no tetanus, but the patient develops a reflex spasm of the masseter and bite the spatula, the patient complains of tetanus. Okay, clear all of you. And then coming to the treatment of tetanus, the treatment of tetanus includes 6 stages. The first one is neutralization of the unbound toxin by using human tetanus immunoglobulin. Okay, there is single intramuscular dose about 3000 to 5000 units in children and adults also. And okay, then tetanus immunoglobulin about 500 units intramuscularly or intravenously, which removes the unbound toxin. It cannot affect on bond to the nerve endings only. Okay, another step is prevention of the further toxin production by debridement of the wound to remove the microorganisms and create the aerobic environment. And recently we recent studies shows that to access at least 2 centimeters around the wound margins to drain the abscess. Okay, another step, antibiotics. Antibiotics usually penicillin. They are if patient is allergic to penicillin, doxycycline, erythromycin, clindamycin is advised. And another drug is metronidazole, which is about 500 mg for 6 hourly, or either 1 gram for 12 hourly. This metronidazole is GABA agonist. Okay, another one is control of spasms. If patient is nursing white environment, avoid the unnecessary stimuli like noise, touch, and heat, and protecting the airway. Drugs used to treat spasms and rigidity and tetanic stages. There are diazepam. It depresses all levels of central nervous system, increasing the activity of GABA, and reduces the anxiety, sedation, and relaxes the muscles. And also using IV midazolam also used, and phenobarbital, which is a sedative, which is also used about 200 mg for intravenously, and skeletal muscle and relaxants like baclofen and methocarbamol. Okay, another step is management of autonomic dysfunction by using magnesium sulfate, which is about 5 mg over 20 minutes only. And the one is supportive care by giving airway and endotracheal intubation. And coming to the prophylaxis by active immunization and passive immunization. In case of active immunization, alum precipitated tetanus toxide along with DPT and vaccine, diphtheria toxide vaccine, which is about 3 intramuscular doses at second month, fourth month, and 6 months of age of babies, and boosted every 10 years. Okay, if in case of passive immunization, tetanus antitoxin is given about 250 to 500 units of human serum, or 1500 to 5000 units of horse serum is given intramuscularly for 4 weeks, 2 to 4 weeks. Then only we can prevent the tetanus. Clear all of you. This is all about tetanus. Then after that we are covered about the gas gangrene. Okay, thank you.